In a standard code blue, you pour every available nurse, medication, and ounce of energy into your sickest patient. In a mass casualty event, that instinct will cost dozens of lives. To survive, we treat the healthcare system as the patient. Disasters like chemical spills, biological outbreaks, weather, or mass shootings target the hospital's baseline. Like a body shunting blood during shock, the hospital activates surge capacity, rapidly expanding care areas and reallocating resources. Managing this systemic stress response requires a continuous cycle through 4 distinct phases: mitigation, preparedness, response, and recovery. Preparedness involves developing plans, gathering supplies, and running drills. Mitigation, however, is the act of proactively preventing a hazard from causing a disaster in the first place, such as implementing land use planning or updating building codes to withstand earthquakes. In a mass casualty event, the healthcare system enters a state of failure. If the nursing staff does not aggressively triage limited resources, the system collapses and the population perishes. To compensate for this massive resource drain, you must execute a mass casualty triage crosswalk. This system forces you to allocate care strictly by a patient's biological survivability, using a 4-color tag system. The red tag is for emergent, Class 1 patients. These individuals have an immediate threat to life, such as a severe airway obstruction or massive shock. They require instant life-saving intervention to survive. The yellow tag covers urgent, Class 2 patients. They have major injuries, like open fractures or large wounds, but they are currently stable. You can safely delay their treatment for 30 minutes to 2 hours. The black tag represents the expectant, Class 4 category. These are patients with injuries too extensive to survive, given the limited supplies, such as massive head trauma, extensive full-body burns, or severe spinal cord injuries. Labeling a patient who is still breathing as a black tag is one of the most difficult things a nurse will do. However, if you spend your energy attempting to resuscitate one patient with unsurvivable trauma, 5 other patients with survivable airway obstructions will biologically decompensate and die while waiting for care. You must prioritize the red tag first. Finally, the green tag is for non-urgent Class 3 patients. Often called the walking wounded, they have minor injuries like closed fractures, sprains, or abrasions. Their treatment can wait over 2 hours. But do not ignore them. Because they are mobile, the walking wounded often leave the scene on their own to seek help. If the disaster involves a nuclear, chemical, or biological agent, these patients will unknowingly track lethal contaminants directly into other hospitals. Withholding care from the unsavable is a mathematical requirement. By sticking to the triage algorithm, you achieve the greatest good for the greatest number of people. We will now transition the whiteboard map to the clinical manifestations of technological and radiological hazards. These human-made disasters present as invisible, systemic threats. Modern disaster etiologies include cyber attacks, which are deliberate attempts to disrupt or damage a hospital's computer systems and electronic networks. If you suspect a breach, your immediate priority is to shut down the computer or electronic patient charts instantly. This rapid action mitigates the data breach and protects sensitive patient information. In radiological events, radioactive materials physically penetrate the body, directly damaging cells and DNA. This cellular destruction leads to acute radiation sickness and carries long-term risks of genetic mutations and leukemia. Because victims of a chemical spill or nuclear disaster carry radioactive particles on their bodies, you must establish decontamination units outside the facility. You cannot allow these patients to enter the hospital until they are decontaminated, or they will create a disastrous secondary exposure for staff and other patients. You must also anticipate pharmacological interventions like potassium iodide tablets. This medication protects the thyroid gland from absorbing radioactive iodine, which prevents the development of thyroid cancer. In technological hazards, the threat is invisible but systemic. Securing the facility's data perimeter and physical doors must precede direct bedside care. In a biological disaster, we differentiate how a disease moves. In a point source epidemic, a large number of individuals are exposed to the exact same infectious agent at the exact same time. A propagated epidemic, like COVID-19 or influenza, is transmitted from person to person over an extended period. Recognizing the specific pathogen quickly is critical. Inhaled anthrax is highly deceptive. Its initial symptoms, fever, chills, and body aches, perfectly mimic a standard influenza infection before rapidly progressing to severe respiratory distress. A painless skin sore with a distinct black center identifies a cutaneous anthrax infection. You must maintain a high index of suspicion for these indicators to differentiate a standard illness from a bioterrorism event. Other highly lethal pathogens require immediate, aggressive isolation. Ebola virus disease presents with a fever, muscle pain, and critical, unexplained bleeding or bruising. Because Ebola carries a mortality rate up to 90%, you must mandate maximum barrier PPE. This requires the meticulous donning and doffing of gloves, gowns, N95 respirators, and face shields. Conversely, during outbreaks of influenza or COVID-19, you must prioritize monitoring older adults. Due to their physiological decline, they are at the highest risk for severe complications, specifically secondary pneumonia and the lethal exacerbation of underlying heart disease or diabetes. Microscopic threats require absolute rigid adherence to infection control. Identifying the exact pathogenic signature dictates the precise barrier intervention required to keep the hospital functional. When catastrophic weather strike, it violently disrupts the hospital's physical environment. High winds, flash floods, or tectonic shifts can shatter infrastructure and cut off vital power grids. You must differentiate meteorological terminology to act appropriately. A watch means conditions are favorable for a hazard to develop. A warning indicates the hazard is imminent or actively observed, requiring immediate life-saving action. During a tornado warning, patients should be moved to interior hallways. However, you will have patients in the ICU who are too hemodynamically unstable or too dependent on mechanical ventilation to be moved. You must stay by their side. The priority intervention for immobile patients is to secure them in their current room, move them away from windows, and physically shield them from flying debris using heavy blankets or your own body. Environmental disasters also trigger secondary medical crises through supply chain failure. You must educate vulnerable populations to pack grab-and-go emergency kits containing essential daily medications, like insulin or antihypertensives, to prevent life-threatening complications while they are displaced. When the environment breaches the hospital walls, the nurse ceases to be just a clinician and becomes the literal physical shield and logistical lifeline for vulnerable patients. This whiteboard illustrates the systems approach. Rely on core priorities. Prioritize red-tagged airways over black-tagged expectant patients, and monitor the green walking wounded. Assess for anthrax eschars, maintain Ebola isolation, decontaminate victims outside, shut down hacked terminals, and shield immobile patients. Finally, once the acute phase subsides, the expert nurse must participate in comprehensive post-disaster debriefings. These sessions are essential to evaluate the response and identify necessary corrections, and they allow you to prioritize your own mental health after managing a crisis. To survive a mass casualty event, you must trust the triage system. By abandoning individual nursing instincts in favor of the population's needs, you achieve the greatest good for the greatest number of people.